Well, thanks for coming, everybody. I hope this presentation is useful. The main thing will be try to encourage you if you are dealing with problems with the foal. Yes, it's good to give it a go, but don't delay too much on referring if you need to, because of obvious reasons. Right. So first of all, when we evaluate foals, we don't just neglect the mare. We also, it's very important, like Jose mentioned, to be combined, to have a history combined between the mare and foal, because most of the risky pregnancies can have an effect on the foals. So for the mare, we basically ask, is this the first foaling? If not, then you may or may not expect problems. If the mare had problems before, for example, dystocias in the past, she most likely will have a dystocia next time. Where is the mare kept? And that is very important, especially in certain areas. You do have fescue in Australia, not so much in South Australia, but you do have in New South Wales and Victoria. So fescue toxicity will cause problems in the placenta and in the milk production, and therefore you will have troubles with the foal later on. So it's very important to ask those questions as well. And then questions about the mare bagging up, and like Jose said, it's just something very variable between mares, but it's something we ask anyways, and if the mare had the waxing up before foaling. Another thing we ask is if you have seen that the mare is leaking out milk, like for example a week before foaling, because that's important, because if she's leaking out milk, then that means that the foal will not get any colostrum at all, and then it's just very easy for us to know what to do then. Okay. Another thing we would ask is if the vaccines are up to date on the mare. Mainly tetanus and strangles are recommended here, but it's, you know, it depends on the area where you live at. If you're in New South Wales or Queensland, then Hendra virus is obviously indicated. And this is important because the foal won't get the antibodies for those diseases through the placenta, but through the colostrum. So very important that the mares are up to vaccination. And finally, we recommend you to evaluate the placenta, and if you don't have experience doing that, just at least take a picture and send it to us, or if you can, just put it on a trash bag, obviously wear gloves, put it on a trash bag and send it to us if you want, and we will be able to help you with that. Okay, like we mentioned, this is just a chart. I can give you this presentation later. I'm not going to go through each of them, but just to let you know that problems on the pregnancy, the placenta, the colostrum, etc., can have an effect on the foal, and you can see there's a bunch of them. So very quickly, because Jose already mentioned this, is the foaling has 3 stages, and once the water break, which is stage number 2, is non-stop. Pretty much it's going to happen really fast. But a thing to mention, again, just to emphasize the importance of this, if you see this red bag, just what you need to do is, well, Jose was nice and he used scissors. I was going to say get a blade and cut it, but just open the bag and get the foal out. Or if you can't get the foal out, just open the bag and call your vet immediately. But first open that bag, don't call us first. And then try to assist with the foal. Okay, and then once your question was about removing fetal membranes or placenta from the foal, we don't recommend doing that just the face, just because it can inhibit respiration, but otherwise just let the foal do its own thing, because the way the mare bonds with the foal is through the placenta. They recognize that smell and they start licking the foal and they start bonding. If you remove the whole thing, the mare will most likely reject this foal, and then you will have to deal with an orphan foal, and it's very annoying and obviously dangerous for the foal because you won't get any colostrum if you don't have a colostrum bank. So just let the mare do its own thing. Just if you want to help, just get the thing out of the nostrils from the foal, and that should be it. Another thing would be the umbilicus. A lot of people clamp or cut that umbilicus. We don't recommend doing that. You can see in the picture, the foal is being expelled, and as he's trying to get up, that umbilicus will just tear itself, and it's just a better way to stop the hemorrhage from the blood vessels that are in the placenta. Instead of clamping and just sharply cutting that, it's just better that it tears itself, and by itself it's going to create coagulation and closure. So don't cut that umbilicus, just let nature pretty much take its course. Once that umbilicus, once that placenta is detached from the foal and the umbilical cord is separated from the placenta and the foal, you can then start disinfecting the umbilicus. It's a good practice to do, especially if your farms are muddy and you don't have the ability to put this mare on a stable, which is quite common. So we recommend doing a part of chlorhexidine into 4 parts of water and just dip that umbilicus twice a day for about 2 days, and that should be it. So normal behavior on a foal, again, Jose went through this. So we expect the foal that in 2 minutes he's already in this position, kind of like head up, not totally up, but just trying to maintain himself in what we call sternal position. 20 minutes, sorry, and then he should start developing a suckle reflex by that time. In an hour, he should be attempting to stand. It's okay if he falls down, but he should be attempting to do this. Within 2 hours, ideally he should be nursing. Within 3 hours, the mare should be able to pass her placenta, and within 12 hours, the meconium, or the first feces, should be passed on the foal. Okay? So this is a 1, 2, 3 rule that Jose went through. Very, very important to remember. So this is just a sequence of what the foal should be doing. So first, 20 minutes he's in sternal. Within 1 hour, he's trying to get up. Oops, he fell down. But he tries again. Within 2 hours, he's up. So that's normal behavior. Once he's done that, and he's to the point that he's about to nurse, then the rest should be relatively, hopefully, smoothly, and he should just be hourly nursing about 4 or 6 times per hour. He just gets up, nurses for about 2 or 3 minutes, urinates, and goes to sleep. That's all foals should do. If you notice that the foal every hour or every 2 hours stands up and nurses for about 10 or 15 minutes, then you may be thinking that there is a problem with the mare. Maybe there's not enough milk. Maybe there is a problem with the foal. He's not able to swallow. One thing is that it's not the same that foals are here attached to the other. That doesn't mean that they are actually swallowing. So what you can do if you are unsure or if you don't have enough foal experience, you can just gently put your hand over the foal's neck and without disturbing too much and try to feel for swallowing. Sometimes if mares don't have milk or if foals have throat problems, like tummy foals for example, you will find that they are not able to swallow very well, or just because the mare doesn't have milk, and you'll find that they are sucking but there's no swallowing occurring at all. So it's very important to check both of them. So if you see a foal being attached to the other for about 10 to 15 minutes, that's not normal. Okay, so that's just normal foal behavior. So how do I evaluate my foal? How do I approach my foal? How do I do a clinical exam before calling the vet? What should I expect? So first of all, is the foal breathing? Yes or no? Are the membranes occluding the nostrils? Yes or no? Maybe I can help taking them out a little bit. Is he breathing? Some foals, especially premature and dismature foals, they don't have mature lungs, and the surfactant, which is the liquid that helps to break the tension in the lungs, is not formed because the lungs are immature, so there's a lot of tension in the lungs and they don't expand with air. So for them it's very hard to breathe, or sometimes they just don't breathe at all and then they die. Is the foal aware of its surroundings, or is just totally dull, depressed, or out of this world? Does he have a suckle reflex? If you are about to check that, please do wear gloves. This is a bad example, I'm sorry. This was in my residency with a calf, and we just put our hands there, so don't do that. Just wear a glove, and if you're going to stick your hand in the foal's mouth, because most of the septicemias and foals occur by GI spread of bacteria. Okay? So, but yeah, check for suckle reflex. Is it strong? Is it weak? Is he attempting to have a suckle reflex or not? Look for cleft palate, which means this opening is obviously not normal. This gets connected to the nasal passages, so every time the foal drinks milk, then he will have milk coming out of the nostrils, and that can lead to, well, most likely will lead to aspiration pneumonia, and they obviously can die. There is a surgery to correct this, but it's extremely expensive, as you can imagine, and sometimes it's just very late because they develop pneumonia. So not good. And check for the umbilicus. We're going to mention the umbilicus in a little bit, but it's something that you need to check. And just palpate the foal's body to see if there is some abnormalities in the ribs. Usually it happens with dystocias or trauma during birth. And some of them, most of them are actually, they just heal fine with rest, but some of them, it may happen that the fracture penetrates into the thorax and punctures the lung or the heart, and then obviously there will be problems breathing, and foals can actually die from that. So aware of its surroundings means, is the foal, if you are in the box trying to see what's going on, is the foal aware that you are there, is a little bit curious, or is just out of this world, like this dummy foal? Okay. Another thing to mention is the 1, 2, 3 rule. You know all this because we have repeated it several times. And just another thing that Jose mentioned, retained placenta, so more than 6 hours can lead for the mare to have endotoxemia and laminitis, and then it can be disaster. You probably save the foal and then the mare dies, so not good at all, and it becomes very expensive as well. This is a mare and foal we just had last week from that have toxemia. About clinical parameters, it's very funny how newborn foals are. Newborns are considered foals less than 2 weeks old, but it's very different within newborn foals how foals from 24 hours of age behave as compared to foals 1 week or a little bit older. The clinical parameters change a lot just because the foal is trying to stabilize in its environment. Okay, so you'll find that if you put a stethoscope at 24 hours of age, you'll find this high heart rate, and that's normal. Don't freak out. It should come down within a week, and when it's an adult, then obviously the heart rate is quite low. Same for respiratory rates. Temperature, as with any mammal, is pretty much the same, stays around the same range. And mucosal membrane should be the same, because that's just assessing the hydration and cardiovascular systems. But you need to make sure that all the mucosal membranes, which include ears, vulva, nose, nostrils, gums, etc., they should be pink and moist. If you find that there is, yellow discoloration, then something's going on. If you find like this one, right? If you find that there is hemorrhages, or what we call petechias, like little hemorrhagic dots, then something's going on. Maybe the foal has a coagulation problem or septicemia, or etc. So always check the gums and check the eyes on these foals. Especially, just keep doing it daily for the first 3 days, because there are some diseases like neonatal isoerythrolysis, when the foals ingest colostrum, and that colostrum has antibodies against the foal's red blood cells, they will break them, and then you will have this. So it's very important you check these things on the first 3 days. The umbilicus, how to check that? Well, check for size. We have measurements. The umbilical stump, which is this thing, should be around 2.5 centimeters of diameter. If it is severely enlarged, if you find something like this, and obviously that's wrong, that's something bad and needs assessment quickly. Also, the umbilicus should not have any sort of discharge. The hemorrhage from giving birth should stop when that placenta separates from the umbilical cord, so you shouldn't have any of those. You shouldn't have purulent material coming out or urine, and if you do, you need to call your vet. And just to emphasize the importance of this, because infected umbilicus is a very good port of entry for bacteria, and that's how foals can develop septicemia and septic arthritis. So that's just the basic physical exam, the things that you should be checking for pretty much the first week. All right. How to handle a foal? If you need to do something like your physical exam, or someone is going to help you, we recommend you to put a hand on the chest and the other on the tail. Obviously, don't crank that tail because it's very fragile. It just helps them to be restrained. If you put a lot of tension, you'll find that foals will have this reflex of kind of collapsing, like shutting down, they collapse. That's normal. If you release that pressure, they will go up. So don't panic if you do that by accident. It's expected. So all you can do is just release the pressure, they will go up. Okay, and most importantly, never grab a foal from the abdomen. So if you need to carry a foal, grab it from the stifles. That way you won't get kicked, first of all, because you are locking the stifles and you are impeding movement. And second, you won't be at risk of rupturing the foal's bladder, which is very, very fragile because they don't have any musculature. It happens a lot, actually. If you carry foals from the belly, from the abdomen, you can rupture the bladder. So please try not doing that. Regarding nutrition, ideally foals should be gaining between ½ kilogram and 1 kilogram per day. The one we had last week was gaining like 3 kilograms per day. He was a monster. But he should be gaining weight regardless of whether he's sick or not. That's why you need to call your vet. Your vet will most likely provide a nutrition plan if the foal is sick, and he should still be gaining some weight. Okay? If the foal is not nursing at your farm, we don't encourage you to do the bottle feeding. It's not the same to feed a calf and a foal. Calves have a special groove that goes from the esophagus to the reticulum, which is the third stomach. Foals don't have that groove, so the milk can go very easily into the trachea and cause aspiration pneumonia. So we don't encourage doing that. In that case, if you have a mare that died or rejected the foal or doesn't have any milk, we recommend you to start training the foal in a bucket as soon as possible. You can start with bowls. You can put one of these baby bottles nipple in the bowl, and the foal can just suck on that, and he should train himself with that. Or you can just put that bucket there. So common foal problems that need veterinary care, pretty much all of them. So yeah, all of them, you should call your vet. All right. So first of all, foals are dependent on colostrum because the type of placentation in the mare, you can see here that it needs like 6 layers to cross from the nutrients and molecules from the mare and the foal. So it's quite a bit as compared to, for example, human and monkey, which the placenta and the foal is interconnected and they don't have to cross pretty much anything. We get everything for free from our moms. But foals and ruminants don't. So that makes them dependent on colostrum, and that's why colostrum is very important. So colostrum is the first milk, and it does have nutrients, it has laxative properties, and it does have antibodies, which are the defenses that are going to help this foal to fight infections in the future. So that's why you need to vaccinate your mare and keep it updated with that. Okay? It's important they consume colostrum, especially within 6 hours of age, because when the foal is born, the small intestine, which is where the nutrients get absorbed, it starts closing over time. So you'll find that by 12 hours it's already closing, and it doesn't allow the molecules to get absorbed into the blood. And by 24 hours it's totally closed. So don't expect that the foal is going to get some antibodies after 24 hours of age. It's just wasting your time. So he should drink within 6 hours, and if you don't see that, just refer your foal and your mare to the vet, and we can, or if you have a bank of colostrum or something, just do it there. But if in 6 hours that foal has not received any colostrum, he should get checked for IgGs and then plasma transfusion most likely. Why is this important? Because we mentioned this has defenses, and if we don't provide that, then the foal will most likely have septicemia and septic arthritis in a few days. So FPT is failure of passive transfer, so failure of antibodies to get transmitted to the foal because of lack of colostrum intake, or because the mare didn't produce any milk at all, like if she was in fescue or there's just poor colostrum quality or something like that. So these are the causes why you can get failure of passive transfer. This is an orphan foal, the mare died, so we had to use our colostrum bank and give it some colostrum. So Dr. Jose mentioned we have the ability to measure IgG or antibodies levels on the foals. For foals, which is different from calves, more than 800 milligrams per deciliter is good, so that's normal. If they have that, we call it failure of passive transfer, and it can be partial if it is between 400 and 800, or total if it is less than 400. And a total one, maybe a partial one you can get by, and if your farm is a relatively thin farm, you don't have to administer plasma. Just keep an eye on that foal. But if it is a total failure of passive transfer, he will require plasma, or most likely he will die in the next month with some sort of infection. So, plasma administration, unfortunately, is expensive because it's commercial plasma, and it's just expensive because it's hard to obtain and hard to process. Okay? If you don't provide that, then again you will have a foal with infections and septicemia, and that is obviously even more expensive because then you have to to go with antibiotics, IV fluids, a nutrition plan, and a lot of nursing care. So if you can prevent all this, then that saves you a lot of money. Umbilical problems obviously are a concern because it can lead to septicemia and septic arthritis. So infected umbilicus, an umbilicus that is enlarged, painful, hot with discharge, just refer it to the vet. And there's two ways to treat this. If it is a localized infection, we can ultrasound the false umbilicus. And if it is localized and very small, medical management is recommended. But if the infection is out of control and you see purulent material everywhere on the ultrasound and it's just not improving with 2 days of antibiotics, you will need surgery for sure. Another problem with umbilicus is this. You can see here, this is a colt and this is his penis, but this is the umbilicus and he's urinating from it as well. So that's what we call patent urachus. Urachus is a fetal remnant of pretty much the bladder on the foal, and it should close during birth. If it doesn't close, it's because there is problems there, and obviously it's not closing, so you need to do something about it. Now the tendency, the old tendency was to do surgery, but there's really no benefit on not doing surgery or doing surgery. Medical management with antibiotics and fluid therapy or whatever the foal needs in that stage is recommended, and exercise, because there's increased tone in the muscles in the abdomen that will most likely help closing all this.
So you wouldn't keep that foal locked up and have him out moving around?
Yeah. Another issue with umbilicus will obviously be hernias, which most of them are reducible, but if in 6 months they don't go back to, to its place, then you may just have your vet check that and operate that later on. Sepsis, obviously you require a vet for these. Foals can go downhill really quickly if they don't receive veterinary attention. So the causes for sepsis are several. The 3 most common would be placentaritis, so again the mare, and that's probably the most common one. The second most common will be an infected umbilicus, and the third one will be sticking your hand after removing the feces on your other horses in the foal's mouth, or respiratory infections. So things like that can cause septicemia on the foal, especially if he didn't drink any colostrum. The signs you will see is that the foal is depressed, there is fever, so above 38.8 in a newborn. Is not nursing frequently or is not standing up because the joints are now involved. Who knows why? Maybe because he doesn't have energy. Something's wrong. You need to call that vet. If you don't treat it, obviously it will lead to shock and death because bacteria are spreading in the blood, and it will cause a lot of cardiovascular derangements, and it leads to shock. And obviously, if you don't treat that, then heart failure and compromise and death. These will need antibiotics, anti-inflammatories, a lot of IV fluids, and supportive care. And sometimes we even have to give what we call vasopressors, which is medicines that help with the blood pressure, because the bacteria that are causing this are causing cardiovascular compromise and decrease of blood pressure. So this is a picture of the intensive care unity on the University of Pennsylvania, and there's a foal, supposedly there's a foal here and here, but you can't see it because of the massive intensive care. There are ventilators and warmers and several pumps, and there's a nurse, and the nurse is hidden there, so it requires a lot of intensive care sometimes. The most common complication for septicemia would be septic arthritis, so very important that during your physical examination on the foals, you touch the whole foal and touch every single joint you can, shoulder, elbows, fetlocks, knees, everything you can, just touch it. And if you notice, let's say, in the next 6 or 8, or whenever you come back and check that foal, if you touch it again and you notice that some things, maybe that fetlock is hot, or maybe that hock is a little bit swollen, just call your vet immediately, because that's probably going into that direction and it progresses really quickly. We had foals that there was one joint involved and you don't do anything about it, and 4 hours later there is 2 more joints involved, and that foal can't get up anymore to nurse, and then just go downhill very quickly. So this type of problem needs prompt assessment. What we are going to do is, since he's already septic and in antibiotics and anti-inflammatories, now we have to deal with the joints as well, and we are going to lavage those joints, sedate this foal for that, lavage these joints, and administer some intra-articular antibiotic into the joint, which again, it can be expensive. Bad thing about septic arthritis is that most commonly it involves more than 2 joints on foals, so it's not just one. Sometimes most likely will involve more than 1. So this is a foal we had in my internship. We have 8 joints involved on this septic arthritis foal. We were able to pull him through, but then he came back 2 months later with diarrhea, fatal diarrhea, and he died, so really sad. Another problem that you will commonly find, perhaps in foals, will be meconium retention, especially if they didn't drink colostrum, because colostrum proves to be a good laxative. But sometimes there's other reasons why. So premature and dismature foals have immature respiratory, GI systems, and sometimes urinary systems. So that could be another one why they retain meconium. Okay, so the way you would see it, it won't be the same as an adult. Colic in foals is different from adults. Adults, they try to die, they lay down, they get up, they roll, they tell you something's hurting. Foals just stand there sadly and they strain, or they lift their tails, or sometimes they just switch their tail violently several times, and that's a sign of discomfort already. Or if you see a foal sleeping on their backs, that's not normal. A foal should be sleeping just in his side with the legs stretched, totally stretched. If you see the foal is in lateral, sleeping in its side and all hunched up, then there's some discomfort there. And if you see the foal laying on his back, that's obviously not normal either. So all those signs you can monitor for meconium impaction or other GI issues. Again, meconium should be passed within 24 hours, but 12 hours is what you should see. Okay? You can try giving a fleet enema at your farm once, but if that didn't help in a few hours, you should call your vet and don't try to solve it yourself, because the foal is probably dehydrated. Something's going on. We need to call the vet if an enema didn't do it. Another thing you may deal with would be what we call dismaturity or prematurity. Prematurity is defined as a foal that is preterm. It's a foal that Dr. Jose mentioned that each mare has its own due date. So if your vet told you the due date and this foal is born 2 weeks before that due date, that's considered premature. Dismature is pretty similar, just in the way that the foals are born within the due date, but they have clinical signs as a premature foal, which would be a thin and small foal, would be a short, fine and silky hair coat, this stone forehead, floppy ears, a lot of signs like that. Most of them, they do have contracted tendons, or even most commonly lax tendons. So you would see these foals, the fetlocks are pretty much touching their grounds because they are dismature or premature. Okay, and that can be caused mainly by placental issues. Again, the mare is a problem, or fetal issues like septicemia because of placentitis or malformation itself, or idiopathic, when we try to say in a medical term, no one knows. So these are examples of lax tendons, but we can correct that with shoeing and little skis. Or contracted tendons in newborns, which can be corrected easily with bandage splints. This is different from grown-up foals. This is just newborn foals can be corrected easily. Grown-up foals, they need other treatments. This is an example of another abnormality, angular limb deformities. We just put splints, and in 10 days he was just fine. Another problem you may have is the dummy foal syndrome, or is also known as ODIS. It's not that common, luckily, because it's very hard to diagnose and very, very hard to treat. But they do well once they receive the intensive care they need to. Okay, so these foals, they are normal at birth. That's why it's hard to recognize, because they are normal at birth. But then you will start seeing that they become a little bit detached from this world, like that picture I showed you. Well, I'm not going to go back because it's just, I don't know, where is it? Ah, that one, yeah. So you see, the foal is not paying attention to the mare. The mare is trying to stimulate it, and the foal is just on his own world. UC Davis in California, this is Dr. Madigan, I just chopped his head, I'm sorry. He's doing research with dummy foals, and this pressure rope he puts in 20 minutes, because there is research going on. No one knows why tummy foals are tummy or, well, maladjusted, but there is a link between autism in people and tummy foals in the way that there is proteins in the brain that they don't seem to switch on at birth, and that's what happens in tummy foals, besides other things like asphyxia and lack of oxygenation, for example, with a red bag. So it's a bunch of things that can give you a tummy foal, but they are doing research with this rope to simulate the birth canal and trying to switch those proteins on the brain on so the foal gets alert and all that. And it seems to help, but obviously it won't help if you have, you know that, for example, your mare had a red bag or something like that, and you spent a lot of time trying to fix this foal. So in those cases, that rope won't help. So yes, they can, it's like pretty much like autism. It can be a spectrum. You can have severe disability or just a little deficits. So it's the same with foals. It can require intensive care if they are severely impaired. It's very difficult to recognize. Foals are normal at birth, and then 2 or 3 days later they start becoming detached from this world. They don't pay attention to the mare. They are licking the walls. They are just wandering around. Sometimes they can't even lay down to sleep. They just kind of forget how to sleep. So sometimes you have to go into the box and physically lay them down, so it's very sad. So yeah, so rope is a nice treatment, if I may say that, but sometimes you will require a lot of intensive care. Lack of oxygenation, then obviously you have to provide oxygen, IV fluids. This foal forgot how to nurse the mare, so you have to provide feeding through a nasogastric tube. It becomes a lot of nursing care. I'm sure our nurses will enjoy having a tummy foal again. Yeah, but if people have the money, they can afford this, and if they respond, which pretty much they do respond very well, it's very rewarding to discharge them, and they seem to do well in the future as race horses. It's not the same as septic arthritis when the prognosis is bad for racing. And I think that's one of the last ones. The neonatal isoerythrolysis is another problem you can find. That's when you see yellow foals between 6 to 70, well, 6, I don't think I should change that. It should be about 18 to 72 hours of age. That's why you need to do checks on your foals every single day, make sure there's nothing wrong with the gums or the eyes or something. Because that, what's happening here is that the foal ingests colostrum that have antibodies against the foal's red blood cells, so it pretty much breaks them and recognizes them as foreign and breaks its own red blood cells, and that causes release of bilirubin that is in the red blood cell, and that's why you see the yellow foals. It's very dangerous, obviously, because red blood cells are the ways we get oxygenation, so if you don't have that, then the foal will die eventually. Some of them stabilize, but if we have the ability to measure parameters, and if we see that the red blood cell count is dropping, then we need to do something about it, like a blood transfusion. Otherwise, that foal will die. So the signs you can see it would be very similar to what Dr. Jose mentioned with a hemorrhage in a mare. So foals that are depressed and lethargic, high heart rates because the heart is trying to compensate for that lack of oxygenation. Respiratory rate will go high because of the same reason, because there's not enough oxygen going into the lung and produced by the lung. And you will see that the foals are yellow in general. Okay. Mule foals, if you have mules or donkeys, they are at more risk. There is 10% of incidence because they do have the donkey factor, which is an antigen in the red blood cells. So yeah, hopefully you don't have mules. But how you can prevent it is you can have your mare tested for that. I am not sure we offered that here. Yeah, maybe in Melbourne, I don't know. But if you have a stallion, you are suspicious, because the problem is actually the stallion, not the mare so much. The problem is the stallion, so you may test the mare for that stallion, and then don't breed. If you have a foal breeding to this mare that had a neonatal isoerythrolysis, then don't breed to that stallion again. That's a recommendation. If you can't test your mare, then the safe thing to do would be to put a muzzle on that foal. Don't let him drink more colostrum from that mare, but he can be with the mare. Just put that muzzle and just provide colostrum or milk from another mare or from a bank or something. Most likely milk, because at this stage the intestine will be already closed, so providing colostrum is just useless at this stage. Yeah, this is a mule foal we had in Morocco. We ended up giving blood transfusion and he did fine. And lastly, another problem you will deal with, hopefully not, but it's less common, but you can deal with this, is if you grab a foal from the abdomen, or there was a lot of trauma during birth, like a bad dystocia that took you a long time, then you can run the risk of having a foal with a bladder rupture. Colts seem to be more predisposed to this than fillies because they do have a narrower pelvis and the bladder is just sitting right there. How you will see these foals will be depressed. You will find that they strain to urinate, kind of like the picture I showed you with the meconium. But actually there's not a lot of urine coming out. You will see that there's not a nice stream anymore. You'll see a few drips or pretty much nothing. And if you see that, then you need to call the vet immediately because that's an emergency, obviously. And there is release of potassium from the urine, and potassium is bad for the heart because it will stop it, and then the foal will pretty much have a stop heart. Yeah, it needs surgery for sure. And before surgery, we need to stabilize this foal and trying to put that potassium back into the cells and drain all that urine from the abdomen. This is a radiograph of a ruptured bladder. They injected contrast from the penis to and then went to the urethra into the bladder, and it should be here, and you can see it's just leaking out into the abdomen. So I didn't have any other picture of a ruptured bladder. Oh, sorry, I promise this is the last one. Another one you can deal with would be rib fractures because of traumatism. Again, dystocias, dystocias that take a long time or are very heavy to get out. You can have rib fractures on the foals. Most of them, luckily, are innocuous and they just heal with rest. But some of them may perforate the thorax or the heart, and then foals can die or can be severely compromised. So if you just suspect of a fractured rib, you just call your vet and we can assess that, whether he needs treatment or not. And this is just an ultrasound showing the rib. This is the bone, this is the rib, and it should be just a line here, but you can see here the step because it broke. And do you have any question?
How long would you put up with a leaking umbilical before you clamp it?
Sorry?
How long would you put up with a leaking, like blood coming from an umbilical cord before you decided to clamp it?
How long? I don't know how long. It usually takes no more than an hour for little drops of blood to stop.
Yeah, if you had one that was steadily sort of squirting.
Right, maybe I wouldn't let go more than 10 minutes, 10, 15 minutes. If you see that, then just clamp it. Yeah.
Yeah, because usually I want to go back to bed.
But usually with foals, you stay up all night. Yeah. I was just joking, yeah. More questions?
Your 1 part to 4 part chlorhexidine, I've got 0.5% chlorhexidine. Is that the
That's
right
good, yeah,
dose?
that's good, yeah. Yeah, I should have put that, yeah, 0.5% of chlorhexidine is good. Yeah. It's less irritant than the iodine.
Mares that have had mastitis, how do they go in later years when they've had one side that's sort of put out of action? Does the other teat sort of, or the other tend to make up for it?
Yeah, usually yes.
Yeah.
Yeah.
'Cause I've got one about to foal that.
Which is completely fine, stuff on the outside.
Oh. Yeah, usually the other one should be fine. It's not that it's connected, hopefully.
And you should raise a foal with no extra care needed, or?
No, I don't think so. As long as she's able to provide good quality colostrum, then you should be fine. Yeah, if you find that the foal is not gaining weight or something, you know, he's nursing for a long time, you may just supplement the foal and put a bucket with foal milk replacer or something like that, just to help the foal. Yeah.
I had a question on the worming. When do you recommend, do you do the 1 week before your due date and 1 week after, or do you do on the foaling day?
Well, it's controversial. The current recommendations for the worming adults are different now, and the American Association of Equine Practitioners recommend to submit fecal samples to give you advice whether we need to deworm or not, because there's a lot of parasite resistance lately all around the world. It probably hasn't reached Australia so much lately, but UK and USA there's a big problem. So ideally, if you're so worried about your mare, then maybe submit a fecal sample, maybe 2 weeks or 3 weeks before the due date, and we can advise you whether you need to deworm her or not.
So if they're below the 200 with your fecal egg count, you're not recommending worming at all on the foaling day?
That's correct.
Right.
Yeah.
Okay. Sorry, just one more question on the heat diarrhea. So that's disproven, is that right?
Yeah, it's not, has nothing to do with hormones as it was thought. It's mostly that the foal has started exploring his environment, and he's just trying the hay, trying his own feces. That's called coprophagia. You see the foals biting a chunk of feces, which is disgusting, and that's colonizing their GIs with new microflora and microbes, which is good, and that those changes in the gut bring diarrhea, but it should resolve by itself pretty quickly.
Okay, so no worry if it's got plenty of energy, looks alert, and all
exactly.
It's self-resolving.
Yeah, exactly. Those are the things you have to look for, that the foal is not depressed, that he keeps eating besides the diarrhea. That's the most important one. If you see that he's depressed or his eyes start being sunken, dehydrated, blah, 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 then obviously that's other types of diarrhea probably. Then you have to call your vet. But as long as he's eating, then it's probably just the foal heat diarrhea, what they call it, and it's just the foal trying to colonize his own GI with new stuff. Mm-hmm. Yeah.
In that case, should we give Protexin?
Protexin, that's probiotics? I wouldn't give that. Yeah, it's normal. It's normal for them to have that too. I wouldn't really give anything. Yeah.
And with your vaccinations with your mare before they're due to foal, like your tetanus boosters, how long before they're due to foal should you give them their booster?
The AAP recommends 6 to 4 weeks before foaling.
One more question. Sorry, on the colostrum testing with the refractometer, if your mare's not leaking at all, is there a risk of infection of trying to milk out colostrum at all?
You mean mastitis or something?
Yeah.
No, not really. No.
Okay.
You shouldn't have that problem.
All right.
It's not like a cow in production that you need to put the positive. I think if you're stripping one little drop to measure colostrum, it shouldn't be a big deal. As long as your hands are clean. Mm-hmm. Yeah.
And you clean the udder of the black sort of schmegma stuff before?
Yeah, I would clean it. Yeah, I would clean it. That. Yeah. 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 Well, thank you.